Okay, so what if I told you a simple shot you might have already gotten could protect you against dementia?
Interesting.
Yeah, we're diving into some fascinating new research today. This possible connection between the shingles vaccine and a lower risk of developing dementia.
You know what? That's really exciting because we're not talking about some far-off experimental drug here. It's a widely available vaccine with a potential huge bonus protecting against a condition that affects so many people.
It really is. And the source for this deep dive, a brand new study just came out in Nature called A Natural Experiment on the Effect of Herpes-Zoster Vaccination on Dementia. And it uses some really unique circumstances to look at this potential link.
Dementia, as you know, is a massive global challenge, right? Over 55 million people are living with it right now. And every year we see something like 10 million new cases. And despite a lot of research, finding ways to prevent it has been really, really tough.
Yeah, absolutely. And that's why researchers are increasingly looking in new directions, exploring these possible links between things like viral infections and our cognitive health. And this brings us to what they're calling an accidental natural experiment in Wales.
Oh, wow.
Yeah, it sounds like something out of a spy novel or something.
It really does. This unique situation created by a specific policy allowed researchers to investigate the impact of this vaccine in a way that helps us get a much clearer picture than we could in most other studies.
Okay, so let's start with the basics, right?
Yeah.
Shingles and chickenpox, most of us know that they're somehow connected.
Yeah, exactly. They both come from the same virus, this Varicella-zoster virus. You usually get chickenpox as a kid. And then the virus doesn't just disappear. It actually goes dormant, kind of like hides out in your nerve cells for years and years.
Almost asleep.
Exactly. And then sometimes decades later, as we get older and our immune systems naturally weaken a bit, that virus can reactivate or wake back up.
Whoa.
And that's when you get shingles, that often very painful rash.
Okay, so how does Wales fit into all of this? What was so special about their vaccination program?
So back in 2013, Wales started offering a shingles vaccine, and this was a specific type called a live attenuated vaccine. Basically, think of it as a weakened version of the virus. It can still teach your immune system what to look for, but without causing the full-blown illness.
Right, so your body can learn how to fight it off without actually getting sick.
Yeah, exactly. And the key part here was who was eligible for this vaccine and when.
And what was so specific about that?
Okay, so the program started on September 1st, 2013, and anyone who was 79 years old on that specific date could get the vaccine for the next year.
Okay.
Then the following year, the eligibility shifted down to those who were 78, and so on. It gradually moved to younger age groups over time.
Okay, so there was this very distinct age cutoff.
Exactly, and here's where it gets really interesting. Anyone who was 80 years old or older on that very first date, September 1st, 2013, was never eligible for the vaccine under this initial program.
Oh, wow.
And it's that sharp age boundary that created this natural experiment that we're talking about.
I see.
Because suddenly you have people born just weeks or even days apart, some who could get the vaccine and some who couldn't, just because of this arbitrary date.
So you've got these two groups of people who are probably pretty similar in terms of their overall health and how they live their lives. And the main difference is whether or not they had access to this shingles vaccine.
Exactly. And as the researchers from Stanford Medicine pointed out, when you compare those individuals born just before and just after that cutoff date of 80, you're looking at groups that are probably really similar in all sorts of other important ways, things that could affect their health, including their lifestyle and any pre-existing conditions.
So it's almost like having a built-in control group in the real world.
Yeah, it's a really clever way to study this.
It is. So then the study comes in, and they look at the health records of a bunch of older adults in Wales. How many people are we talking about?
They analyzed over 280,000 older adults, specifically those between 71 and 88 years old at the start of the vaccination program and who hadn't been diagnosed with dementia before.
Okay.
And they focused their analysis on those closest to that critical age of 80. So those who turned 80 in the week right before September 1st, 2013, and those who turned 80 in the week right after.
So essentially those who just made the cutoff and those who just missed it.
Exactly. And then they crunched all that data to see what they could find.
And what was the big result? What did they find?
The main finding was that the people who received the shingles vaccine were 20% less likely to develop dementia over the following 7 years compared to those who didn't get the vaccine.
Wow, 20%. That's a really significant reduction when we're talking about a condition that affects so many people.
It really is. And, it's important to keep in mind that not everyone who was eligible actually got the vaccine. The researchers took that into account when they were making their calculations.
Right. So the 20% reduction is their best estimate of the vaccine's impact, even with less than full uptake.
Yeah, and they also saw the benefit you would expect in terms of fewer shingles cases.
Oh, did they?
Yeah, the study found that the vaccine reduced the occurrence of shingles by about 37% in the vaccinated group over those 7 years.
So it did what it was supposed to do in terms of preventing shingles.
Right, exactly. And that lines up with what we already knew about the effectiveness of the vaccine.
Okay, so we've got this link between the vaccine and lower dementia rates.
Mm-hmm.
But I'm sure the researchers thought about other reasons why this might be the case.
Right. Oh, yeah, absolutely.
How did they try to rule out those other explanations?
That's a really crucial point because in a lot of studies, it can be hard to tell if it's the thing you're studying, in this case, the vaccine, that's actually causing the effect, or if it's something else.
Right. Like maybe people who get vaccines are just generally more health conscious to begin with.
Exactly. And that's where the brilliance of this Welsh policy comes in, because it created these two groups that were so similar in age and likely in their health habits.
With that one key difference.
Yeah, the vaccine eligibility based on their birth date.
I see. So it really helps to control for those other factors.
Right. And the researchers went to great lengths to check for any other differences between these groups that could explain those lower dementia rates. They looked at things like education levels, whether people were more likely to get other preventative treatments like flu shots, and if they had different rates of other common health conditions like diabetes, heart disease, or cancer.
And what did they find when they looked at all those other factors?
They didn't find any significant differences in any of them. The only notable difference they saw was the reduced rate of dementia in the vaccinated group.
So that really strengthens the argument that the vaccine itself is playing a protective role.
Exactly, it really does.
Now, the study also mentioned that this protective effect seemed to be stronger in women. Any thoughts on why that might be?
That's a good question and one that needs more research. But the researchers offered some possible explanations.
Okay.
One idea is that it could have to do with differences in how men and women's immune systems respond to vaccines. Women tend to have stronger antibody responses on average compared to men. Another possibility is that it relates to differences in how dementia develops in men and women, or even the fact that shingles itself is more common in women.
Right.
So it's possible that the vaccine is interacting with some underlying biological processes that differ between the sexes.
That's fascinating. Okay, so we see this link. But what's actually going on? How could a shingles vaccine possibly help protect against dementia?
That's the million-dollar question, right? And the study doesn't give us a definitive answer just yet, but there are some leading theories.
Okay, let's hear.
One possibility is that the vaccine is boosting the overall immune system in a way that offers some protection against the processes that lead to dementia. Another is that it specifically reduces the chances of this Varicella-zoster virus reactivating.
Okay.
So maybe this ongoing low-level viral activity in the nervous system actually contributes to the development of dementia, and the vaccine helps to keep that virus in check.
So it's like the virus is constantly poking at the brain, and the vaccine helps quiet it down.
Yeah, that's a good way to think about it. Or there could be other biological pathways involved that we just haven't discovered yet.
So many possibilities. And what about those newer shingles vaccines? The ones that are supposed to be even better at preventing shingles, could they have an even bigger impact on dementia risk?
It's a really important question, and unfortunately, this particular study doesn't give us that answer because it used that older live attenuated vaccine, and the newer ones work a bit differently.
Right.
But it's definitely plausible that the newer recombinant shingles vaccines, which use just specific parts of the virus and have shown even better protection against shingles, could also protect against dementia, maybe even more effectively. It's definitely something that needs to be studied further.
It sounds like there's a lot more research to be done, but this initial discovery is really exciting. Has this spurred other researchers to look at data from other countries with similar vaccine programs?
Yeah, actually, over the last couple of years, the research team has looked at health records from other countries that also use that live attenuated vaccine in a similar way, including England, Australia, New Zealand, and Canada.
Wow.
And they've reported seeing the same strong protective signal for dementia across all those different sets of data, which really strengthens their initial findings from Wales.
That's really encouraging, but as much as we like this natural experiment setup, it's still an observational study, right?
Right.
What are the next steps to really nail down this potential cause and effect relationship.
So you're right, this wasn't a randomized controlled trial where you randomly assign people to get either the treatment or a placebo, which is like the gold standard for proving cause and effect. This was an observational study, but the next step to really confirm this would be a large randomized controlled trial, and that's exactly what the researchers are advocating for.
And how would that work?
Well, they'd randomly assign people to get either the live attenuated shingles vaccine or a placebo, and then they'd follow them over time to see if there's a difference in dementia rates.
Sounds straightforward enough, but the study mentioned that the live attenuated vaccine isn't being made anymore.
Right.
So how would they do a trial like that?
Well, that's the tricky part. They'd need to get special funding, probably from philanthropic sources, to actually produce that specific vaccine just for the trial.
I see.
It's a challenge, for sure, but the potential benefit to public health, if this link is confirmed, is just enormous. It's worth exploring.
It really is, and based on what they've seen in the Wales data, how long might it take to see results from a trial like that?
That's a great question, and the researchers have actually pointed out that in the Wales data, the dementia rates between those two groups started to look different in as little as a year and a half.
Wow, that's pretty fast.
Yeah, so a well-designed randomized trial using that older vaccine might actually give us some answers relatively quickly.
That's really promising, and for those who want to learn more, this all comes from the study, A Natural Experiment on the Effect of Herpes-Zoster Vaccination on Dementia by Marcus Eating and his colleagues, published in Nature on April 2nd, 2025. There's a lot of brainpower behind this one, with researchers from Stanford Medicine and even the Vienna University of Economics and Business, and it looks like they had some pretty significant funding, too.
Yeah, the study was supported by a number of organizations, including the Phil and Penny Knight Initiative for Brain Resilience, the National Institute on Aging, the National Institute of Allergy and Infectious Diseases, and the Chan Zuckerberg BioHub.
So it seems like there's a lot of interest in this area.
Definitely.
So to sum it all up, this research suggests something pretty amazing, that a vaccine many of us have already had or could easily get might offer an unexpected layer of protection against a really devastating condition.
Right.
But of course, we need to be cautious. While these findings from this real-world experiment are incredibly promising and supported by data from other countries, we still need that definitive proof from a randomized controlled trial to say for sure that this link is real and to understand exactly how it works.
I agree. And I think what's really fascinating here is that it makes you think, could the vaccines we already have be doing more for our long-term health than we realize? Maybe we should be looking at these vaccines and other medical interventions in a broader way, considering their potential benefits beyond just preventing the specific diseases they're designed for.
Yeah, like unintended but really positive consequences.
Exactly. And this discovery definitely opens up some exciting new avenues for dementia research and for thinking about prevention in new ways.
It really challenges us to look beyond that traditional focus on amyloid plaques and tau tangles in the brain, and to consider other factors like the role of our immune system and even these seemingly unrelated viral infections.
Right, and that's a really exciting thought because it could lead to new breakthroughs in how we approach this global health challenge.
It really could. So for those of you listening at home, maybe it's time to ask your doctor about the shingles vaccine, not just to avoid that nasty rash, but potentially for a much bigger reason.
And who knows, maybe this is just the tip of the iceberg. Maybe there are other hidden benefits waiting to be discovered in the medicines and treatments we already have.
And that's something to think about.
It really is.
Thanks for joining us on this deep dive. It's been a fascinating one.
Absolutely my pleasure.
We'll see you next time.
See you then.